How effective were medieval herbal remedies for health? Have you ever wondered how people in medieval Europe managed their health without modern medicine? The answer lies in the fascinating world of herbal remedies. Let's take a closer look at how effective these remedies really were. In medieval times, herbal medicine was a key part of health care. Before hospitals and formal medical practices became common, people relied heavily on plants for healing. Monasteries were crucial in this process. Monks tended to herb gardens and created texts that compiled knowledge from ancient sources. These texts guided the use of various plants, blending local herbs with spices from distant lands. Many herbs used in these remedies had real benefits. For instance, vinegar was commonly used to clean wounds due to its antiseptic properties. Mint was often applied to treat bites and wounds. Other plants, like wormwood and licorice, helped with stomach issues and fevers. Some mixtures, such as henbane and hemlock, were used for joint pain, but they could also be toxic. The understanding of health during this time was shaped by the humoral theory. This theory suggested that health depended on a balance of bodily fluids. Additionally, the doctrine of signatures claimed that the appearance of a plant indicated its healing properties. For example, lungwort was thought to be good for lung ailments. Despite some effective remedies, there were limitations. The knowledge of disease causes was not well developed, and dosages were not standardized. This meant that the effectiveness of treatments varied widely. The skill of the practitioner and the quality of the herbs played a significant role in the outcome. Culturally, herbs were also seen as having spiritual significance. Healing was often linked to divine will, which influenced how patients viewed their treatments. In rural areas, many people had a good grasp of local herbs and used them for everyday health issues. Monastic gardens and local herbalists were vital sources of remedies. Herbal medicine was integrated into daily life. People commonly cleaned wounds with vinegar and used salves made from herbs to treat infections or pain. This practical approach to health was essential for many medieval Europeans. In summary, medieval herbal remedies were effective for treating minor injuries, infections, and common ailments. They were supported by a mix of practical knowledge, ancient texts, and cultural beliefs. However, the era's limited medical understanding and reliance on non-scientific explanations for disease impacted their overall effectiveness.